This morning we're going to be talking a bit about why would a man lose his sex drive as he gets older? Unfortunately, it's more than just testosterone. Pregnenolone, dehydroepiandrosterone, and prolactin levels are all in a robust range in our youth. And all of those hormones are involved in human sexuality. They all tend to decline. So what are you going to do about it? Hello, I'm Dr. Jerry Mixon from Longevity Medical Clinic. This morning we're going to be talking a bit about why would a man lose his sex drive as he gets older? Because most men have a very strong attachment to their productivity and their sexuality. If you want to pick a fight with any man on planet Earth, you impugn his ability to take care of the people who depend on him, or you impugn his sexuality, and you'll get the fight you're looking for. It's just the way we're made, okay? So, toxic masculinity, call it what you will, but it is the way we males are made. Because of that, when a man starts losing either his sexuality or his productivity, we have a problem. And in our society, we basically mandate that a man lose his productivity in his 60s to early 70s, which is almost crazy. We tell a man that when you're 65 years old, you're supposed to retire. You're supposed to stop being productive. His children are grown, they're gone. There's just him and his wife. Their sexuality has faded away, and the guy doesn't have a whole lot left to which to anchor his basic self-identity. So I don't recommend retirement. I'm 76 years old. I work every day. I'm having a great time. I have no plan to retire in the near future. So the only other one to be concerned about is my sexuality. And yes, if my libido faded away, I'd also be concerned. Can't help it. I am male. It's part of the way we are made. So, get over it. We are not women with a penis. So let's talk about, why does a man have a high libido? Well, first of all, we're made that way. And yes, testosterone is involved. Unfortunately, it's more than just testosterone. I wish it was that simple. We had a patient recently who was in his 70s who contacted his doctor somewhat distressed. Now, we had put him on a testosterone cream. Our goal is to keep his free testosterone in the range of 150 to 180 nanograms per deciliter. This fellow had gotten to that range and his libido had not picked up, so he started raising his dose without telling his doctor. When they checked his testosterone levels next time, his free testosterone was in the range of 400 nanograms per deciliter, and his libido had not improved. He was quite distraught. He wanted to know what was going on. Well, that's why this particular video got triggered. So let's explain what does go on. First, yes, testosterone is part of our sexuality, and it is especially robust in our youth. A young man, 18 to 20 years old, is running a total testosterone of 1,000 to 1,200. A young woman is running 70 to 80 nanograms per deciliter. You see the mismatch? She's about 1/12 of what he is. So we are testosterone driven in our youth. But it's not just testosterone. Pregnenolone, dehydroepiandrosterone, and prolactin levels are all in a robust range in our youth. And all of those hormones are involved in human sexuality. Additionally, women cycle once a month. We men cycle twice a day. We tend to peak our testosterone sun up and sundown. That's why when you men were young, you woke up in the morning with a raging erection wanting sex. And then about sundown, when the woman in your life was trying to clear the dishes, because we're old traditional sort of guys, we had gender roles that were pretty well adhered to, she was trying to take care of her business in the evening, and you were groping her from behind because sun was going down and your body was screaming for sex once more. We cycle twice a day. They cycle once a month. Our cycle is so fast and such a normal part of our life that we don't even recognize we're doing it. but we are. We are the hormonally driven ones, not women. You should never refer to a woman as hormonal. We're the hormonal ones, guys. So, get used to it. It's real. As we age, our testosterone starts dropping. But you really only need a total testosterone in the range of 200 to 300 to have a good libido. You don't really have to have that 1,000 to 1,200. And a 60-year-old man is usually running around 200 or so for a total testosterone. Now, the woman in his life, presuming she's of a comparable age, is down around 7 or 8 when he's at 200 to 250. So you see there's still that youthful mismatch. It's just been carried to an extreme now as we age, and our end organs that are producing our hormones are failing. But also, pregnenolone, dehydroepiandrosterone, prolactin levels are also failing. The particular situation I described, in which he drove his testosterone sky high, is because he didn't understand it's not just testosterone. Remember I talked about that morning-evening shift in our sexuality. That's because our testosterone is shifting. Testosterone receptors need to be filled and emptied. We fill them up, we empty them out. We fill them up, we empty them out. It's that change, that filling and emptying, that causes the rise and fall in our libido. When you fill testosterone receptors all the time, which is what happens when you get testosterone as a shot or pellets, or you don't wash off your cream at night, you will eventually start losing your libido because those receptors never get a chance to empty out and then refill. They stay full all the time, and you now desensitize the receptor, and you don't even recognize you've got testosterone in those androgen receptors anymore because, well, you've never let them recover. Okay? So if you're going to maintain a decent libido, your testosterone needs to rise and fall, rise and fall. That's the big problem I have with people who want to get testosterone shots. You don't rise and fall. You put some in, you go too high, you stay too high for a week or so, it fades down. When you get too low, you take another shot, you drive it too high again, but you lose that rise and fall on a daily basis. Same problem with the pellets and the creams. We can put them on, we can wash them off. The half-life of testosterone is about 75 minutes. So if you put your cream on in the morning, you wash it off in the evening, hour and 15 minutes after you wash it off, your levels are dropped by 50%. Another hour and 15 minutes, they've dropped 50% below that. And you can see your levels get down to your natural baseline pretty fast. So rise and fall, not just peak testosterone level. We need that natural rise and fall that our bodies are designed to have. Now, DHEA, pregnenolone, and prolactin are a little different. They all tend to decline. They don't seem to have that diurnal variation, at least not to the extent of testosterone. So we can just kind of boost those into a mid-range and hold them there, and most people will do quite well. Progesterone is a hormone that is common to both men and women. We usually think of progesterone as a woman's hormone, but it isn't. A young man has progesterone levels at almost the same level as a young woman. We just don't have menstrual periods to show us where our progesterone levels are. But progesterone helps prevent our prostate from enlarging, and prostate enlargement will indeed trigger the inability to have sex. It will trigger erectile dysfunction, because as the prostate enlarges, the bladder's not able to empty, the nerves to the penis go around the bladder and the prostate, and they get stretched and damaged, and so men with urinary retention always end up with an inability to have sex. Now, that's not libido per se, that is erectile function, but the two are related. It turns out that there is a training effect. When men have vigorous erections, it moves their mind back towards sexuality. There's something about a full, hard, tumescent penis that makes a man want sex. All right? So it's not just hormonal, it's also physical. And if he's developing low capacity for physical sex, then he's also going to find that his emotional capacity is damped down too. So prolactin levels have to be in a good place. Testosterone, yes. Progesterone, yes. We want some progesterone. We don't want too much. In fact, we used to use high progesterone levels to effectively castrate men back when homosexuality was considered to be a emotional deviancy that we had to control. Men convicted in criminal courts of being homosexual were often put on Depo-Provera, which is a long-acting analog of real progesterone. We'd raise his progesterone levels very, very high, and he would lose interest in sex. So checking all your hormones, not just your testosterone, is important, and using progesterone and testosterone properly is important. But then there are other physical reasons. Chronic pain. It's hard to be interested in sex when you hurt. So hip pain, back pain, knee pain, neck pain, any pain is going to inhibit your response to sexuality. Also fatigue. Just being tired. And guess what? As you get old and your muscles are fading away, you fatigue more rapidly and you need a nap. And it's not an excuse to lay down and have sex. It's an excuse to lay down and go to sleep. Cardiac output. As men age, just as women age, our hearts are becoming less functional. Those muscles, just like every other muscle in our body, and the heart is a great big muscle, is getting tired. It doesn't pump blood as effectively. Low cardiac output results in low libido and erectile dysfunction, both. Now, from a physical standpoint, if a man has both low libido and erectile dysfunction, if we can fix the erectile dysfunction, we can often trigger a return of his libido. So the two go together. The other reason that men have problems with their sexuality is emotional. Okay? Sex is both physically and emotionally taxing. If you're fatigued, you're tired, you're depressed, you're not going to be very sexual. Okay? You lose desire, and depression is a common consequence of low testosterone. As a man's testosterone drops, his drive, ambition, self-confidence, the joy in life goes away. Now, there's a big difference in how a man feels emotionally with a testosterone of over 1,000 and a testosterone of 200. Okay? And if you want to see a real disaster, you see those men whose urologist have put them on a testosterone blocker, and we shut down all their hormones. They lose their testosterone, their pregnenolone, their dehydroepiandrosterone, and depression becomes a serious problem. Suicide rates in men whose hormones are blocked goes up dramatically because they literally would rather die than live that way. So we need to use those hormone blockers in men very sparingly. Use them when you really have to have them to save the guy's life, but don't throw them at people unless you're quite sure that they need to have this joy, the enthusiasm, the drive, the ambition, the appreciation of being alive stolen from him, because that's what you're going to do when you damp down all of his sex-related hormones. And depression destroys all of life's joys, including sex, and that is often related to low T. So raising a man's testosterone will usually improve his state of mind. Not always. There are other reasons to be depressed than low testosterone, obviously, but it's a very common problem. And then there is performance anxiety. As I said earlier, we men connect our sexuality to our very identity. When a man has his erection fail for the first time in his life, it's traumatic, right? It doesn't matter why it failed. If it failed, all of a sudden, his anxiety levels go up. And anxiety in a man is the enemy of sexual performance. A man who's worried that he won't be able to perform often will. And look at the word I just used, perform. Yes, we do look at it as a performance. It is performance demonstrating your masculinity, your maleness, your humanity. It is what you are. And a man who can't have sex takes a real beating emotionally. And if you've taken his job and his productivity away from him in addition to his sexuality, you've done a horrible thing to that man. Okay. So another one is boredom. Sex for men is not the same as sex for women. We are two radically different creatures. I wish the woke among us would recognize that. Men and women are very different creatures. When a man is having sex, he's having an adventure. He's fulfilling his fantasy life too. Often fantasy and sexuality are very tightly connected. That's why visual porn is so important in many men's lives. It provides them with that adventure that they may lack in their day-to-day real life. Because guess what? After 40 or 50 years of marriage, neither he nor she are the robust, beautiful young creatures they were when they first got together. And no matter how much you love someone, and this goes for men and women both, so guys, look at yourself in the mirror honestly. The fact is, it's the same kiss, the same touch, the same hug, the same caress, the same technique. It's the same, and boredom often sets in. I know that this is not a politically correct thing to say, but I'm going to say it anyway because it happens to be true, and quite often the truth is not politically correct in our fantasy-driven society. There is no aphrodisiac like variety. For all of human history, powerful, rich, upscale, leader, type A males have had more than one female in their life. It was codified in Judaism and early Christianity and Islam and in Buddhism and in just about every religious organization on planet Earth throughout human history. The alpha males are female collectors, and women are designed to find the alpha male attractive. Lots and lots of women. No, women are not gold diggers, but they are attracted to men with power, affluence, and the ability to protect their young. It's just, once more, not socially acceptable, but it's true. When you've had only one partner and you've had that same partner for 40 or 50 years, well, it's the same. And you guys, he and she, need to look at it honestly and figure out what you can do to spice up your life a little bit. I'm not going to make suggestions that are going to get me canceled. All right. But the reality is you need to look at ways to spice things up. And then there are emotional disorders such as autism. Autistic personalities typically have major problems connecting to other human beings, and that includes romantically as well as every other way. Autistic personalities tend to have large troubles with long-term romantic relationships. Unfortunately, in our community, we see a fair bit of that simply because folks who do better with machines than with people tend to gravitate to working with machines. Guess what? All of the techies and coders in our community tend to be. Yeah, many of them are somewhere on the Asperger's scale. So some degree of autistic personality is very common in the Seattle area, and I suspect it's equally common down in the Silicon Valley area. So those are the primary reasons. Now, what are you going to do about it? Well, the hormone things are pretty easy, at least for our clinic. It's what we do for a living. We'll move all of those hormones back to where we are. We'll arrange to have your testosterone fill up and empty out and fill up and empty out on an everyday basis, and that's got a good chance of bringing your libido back. The emotional problems are a little tougher to handle. That may require a marital counselor or even a sexual counselor. Okay? But you need to be looking for a little excitement, a little variety, some change-ups, some different ways of doing things. And yes, I understand that some folks have strong religious objections to pornography, but porn can help a fair number of couples if they're both willing and comfortable to engage in it as a couple. Anyway, that's why men tend to lose sex drive, and in another video, I'll address women. Thank you for watching. I hope I didn't offend too many people, but if I did, well, sorry, but I tell you the world I see, not the world I wish I could see. This is Dr. Jerry Mixon for Longevity Medical Clinic, signing off till the next video.